Welcome, everyone. I don't know what day it is, but we are here live with this incredible crew. Thank you guys so much for taking time out of your busy schedules to hang out with us and to share everything you have been preparing um, coming up this October in Vienna. So, we're going to go around the room, introduce everyone, and learn more about the Vienna Airway Congress. We're going to start with you, Dr. Christian.
Hi, everyone. Let me introduce you. I'm Christian Leonhardt from Germany, and I'm a general dentist and an orthodontist. And I'm so proud that we are here in this group to discuss about all of our journey, all of what we are talking about, the Vienna Airway Congress. And it was a long journey to bring this up. And we are so proud that we have this 2-day program in Vienna where we bring all our knowledge and where we bring the protocol, where we bring our strategies to solve the problems in the airway management. So thank you, Renata.
Of course, Dr. Clemens, you're up. He is driving from Italy, and he told me I'm about to lose signal, and he did. So we're gonna wait a minute. Dr. Stanley Liu.
Thank you, Renata. Thank you, your Airway Circle fans. I'm Stanley. Been in the sleep surgery space, in the study of which for almost a decade now. Really excited to be part of our this effort, really led by our European colleagues, on disseminating, on teaching, on sharing the practical approach to adults and children with sleep breathing disorders. I have been in a fair number of conferences. I've spoken on some of my views and my work. And I think what is two observations. One is in Europe, all the specialists are really, really, really good at what they do. There is no question about it. I think a lot of the technology and the applications are outstanding. The second observation is, just like sleep everywhere, though, when it comes to sleep and breathing, you really need a multi-team discussion amongst the professionals, amongst how we speak with the patients. And in that way, we're all having the same challenges and then finding solutions. And I think this Congress in Vienna, where I find it's most unique, is that sort of a very neatly packaged information and tools that participants can bring home while these tools are taught by some of the top professionals in their field for, let's say, long-term collaboration and discussion. So I'm super excited to be part of it.
Thank you, Dr. Claudia.
Hey, Renata, thank you so much for hosting this session. I'm one of your biggest fans, and I know you have a lot of fans. And I know that because your fans then become patients of mine. So, Renata, you're based in the US, I'm in Europe, in Austria. And the reason why we host this Congress is because patients who call me up from Norway, from all parts of Europe, who are willing to fly hours to my office to receive treatment because they cannot find a healthcare professional that can help them with the problem of their child or their own problem. And so parents would say, they've witnessed health issues. The child is always tired, and each doctor they see, they say everything is normal, but they know, okay, there's something going on. And this is why I'm so thankful for all the awareness you create in your community with your reach. And I think we are all united by this drive to bring knowledge to sleep-related breathing disorders and treatment options. And this is what we will bring at the Vienna Airway Congress, the latest innovations, the history, the past and the present, as some of the titles of Dr. Liu go. And yeah, I couldn't be more fortunate to be in this team of highly knowledgeable people, all of you. So yeah, thank you for hosting this session today, where we can talk a little bit more about what people can expect from the Congress. And yeah, I'm ready to give the word over.
Yeah, perfect. Dr. Florian, thanks for being here.
Hi, Renata. Sorry that I'm late, but I had a hard time coming here because I was in the middle of the lake and suddenly the wind broke down and we were sailing. And so we had no wind to come back. So I was trying to come back as soon as I could.
Oh my goodness. No, you're good. So introduce yourself to the crowd.
Yeah, so my name is Florian Six, and I'm in the organizational team of the Vienna Airway Congress. I'm not a speaker there, but I'm really proud of being part of it. And I'm really looking forward to this Congress, where a lot of experts and perfect speakers will meet together.
100%. So I was blessed enough to be passing by in Vienna last year, and I stopped by and I messaged Dr. Claudia, I'm going to be in town. She goes, come out to dinner with me and Dr. Florian. And oh my gosh, I'm such a geek when it comes to this stuff. He literally brought his computer. He was like, do you mind if I show, are you interested? I'm like, please. So we spent, I don't even know how long, but an hour looking at the incredible work that you guys are doing. I have not seen anybody do what you guys are doing, and my mind was blown. And we still need to set up a time for you guys to come on Airway Circle and maybe share some cases, because people need to see this. And it's really going to be mind-blowing in Vienna because you guys are all incredible. Dr. Claudia, what are you most looking forward to for this conference coming to Vienna?
To have people who have the same progressive mindset that, medicine keeps evolving and we need to keep evolving. And, the way I practice has changed dramatically now that I look at breathing as well. And, just simply asking the patient about, hey, how's your sleep? How's your breathing during sleep? They realize that, I'm really interested in their health, and this totally changes the patient-doctor relationship. And I find it very fulfilling if I can help somebody, not only to provide them with a great smile, but also help their breathing during sleep and make them wake up more rested and feel better about themselves. This is incredibly rewarding. And I am so much looking forward to learning from everybody who is going to present there and to learn from what people have to say. It's the stories that they encounter in their practices that really are so touching. So I'm looking forward to every participant of the Congress and hear how they're practicing and where they at their journey.
Dr. Clemens, I think that your signal is back now. Do you mind saying hello to everybody?
Yes, I'm back. I have signal now. Hi, everybody. Let me introduce real quick myself. I'm in my car right now, heading back from Italy. But when I'm not in my car, I'm working and living. I work and live in Augsburg, working together with Christian Leonhard. It's a big honor to be with him in the office and working with him every day. And I'm a general dentist. And right now, I'm a little bit more focusing on the treatment of children and doing assessment in early childhood. And my focus is on prevention, because I think prevention is one of the most important things for the future of the whole airway management, airway health and wellness, because then we can provide these children a healthy life, a good development, and a good growth. So this is my passion, my focus right now, and I'm so looking forward to discuss these important topics with all of you, with all the participants of the Congress, because it's really a new field. So we have to discover all the points together and learn from each other. And I'm really looking forward to share our concepts, our knowledge with all you guys on the Congress, and to learn new stuff as well, because it will be a really open discussion, and I'm really, really excited and looking forward to this.
Perfect. As a new dentist that just heard for the first time anything about this new airway thing, why would you say they need to come to the Congress, and what are they expected to see over there and learn? Dr. Clemens.
So I guess this whole topic about airway and wellness and health is changing dentistry like in a huge way. Dentistry was all the time like looking on teeth, looking on skulls, and doing something, treat something on teeth, but now it's changing for a better health, a better life. And this is a huge impact. So now we are part of a whole group of professionals treating human beings for a better life. And I think this is the most important point why you should really learn about this topic.
100%. I spent the day today with Roger Price, who founded IOP. They are going into kindergarten classes and checking these children out. They just came back from Romania, and I saw some of the data that they have collected, and it is insane how so many of these children are being missed because we don't know what we're looking for. So I think that one of the things
Yes,
that's important for us to going into conferences like these, it's because we are going to be able to show you what to look for. You don't have to, jump into this where you're going to treat tomorrow, but as soon as you see it, like everybody says, you're not going to be able to unsee it. So I'm so excited that you guys are putting this together in Europe. There are so many patients that contact us every day, like Dr. Claudia said, trying to find somebody who will look beyond their symptoms and try to find a way to fix it. Somebody just posted over here on Instagram, said, Dr. Claudia, we're not in the same room. Somebody said, I'm so excited to go. Katie, are there going to be any CEUs for different professionals? Is it just dental? Do you know if people are going to be able to? She's a speech pathologist.
Kristen.
Who is responsible for CEUs? Are we going to have CEUs there? Continuing education credits? I don't even know.
Yes, we do have. We do have them.
Awesome. Fantastic. Dr. Stanley, what are you planning to talk about whenever you go there? What are your topics?
Well, I should say more of, I'm going there to listen to everybody. I think my input there is really to, the whole meeting is built on two basic foundations. Okay. One is on the practical side, right? Like when the patient walks in, and they could be coming in for any procedure or specifically for airway and sleep related concerns. What's my approach? How do I make that next half hour, 1 hour meaningful? Now, that's the practical side. The philosophical side that I've been lecturing on for quite some time now, and really it's more of a something that I've learned over the years, and that is the importance, the urgency of developmental milestones. And so if we catch them, so there are times when we have to be like feel a sense of urgency about it. If we're nearing the end of a time point for skeletal maturity, for soft tissue related muscle development, like there are moments when we really have to be like really urgent with the patient, and there are times when we can observe, and the timing and the cadence of which will be reflected actually by the meeting schedule itself. So we will be you'll be picking up practical tools, but you'll also see, so at different ages or different stages of development, all right, what are the timely things to do? Oh, and I should say there's one more thing, which stresses me out mildly. And that is that this meeting also wants to emphasize wellness of the doctors and the therapists themselves. So many of us, I think, have spent a lot of years in training, oftentimes having had to put aside a lot of things, including our own wellness. And that will be emphasized in this meeting. And the part that stresses me out is Christian is going to lead us on some kind of a run around the city. This morning, I actually just saw on my YouTube some marathon running popped up. See, the problem with our phones, they know what we're stressed out about. They know what we're thinking about. So yeah,
Are we all going to be taping to run?
Oh no! Don't make it harder now. Oh, come on now.
I will bring
It's
some.
not enough that I participate in this run. I have to act like I'm nasally breathing the whole time. So 3 things. Practical tools, yes. We want you to go home and be like, hey, patient comes Monday. There's a few things I can add in right away, and that's gonna slowly help. I want folks to start looking at what stage of life this patient is in and how we can impact. And then lastly, make sure that we're safe and good ourselves. So super high hopes for this meeting. No hopes for myself in completing the run, but I'll get started.
Dr. Christian, is there anything that you're not trained in?
That is a great question, actually. That is
the more you know, the more you know what you don't know.
Yes. You're like everything. So, but tell us, an orthodontist who wants to start doing more, looking a little bit more at the function, and treating adults also, what are their options right now, as far as courses to take, and how should they approach entering into this new field?
This is a good topic because in traditional orthodontic treatment, you see the models, you see the teeth, you see the traditional role of the bite, you see the traditional role of spaces and arches. What we now change is the paradigm of the treatment planning. So we start now from the face, we start from the profile, we start from different sagittal and transversal dimensions. And the last thing we were looking at are the teeth. So this is an important role, how we should start to understand that this whole thing is changing and there's a whole new treatment planning. So from a prosthodontic point of view, where we try to meet each other, was the facial generated treatment planning. So from an aesthetic plane, from the front teeth to the back teeth to lower teeth, then going into the function, going into biomechanics, and ending with perio. The end is now that everything can work, but when you don't see what's going on with the airway, there are a lot of things compromised. And we now understand that we often treat so much the symptoms, and we should start to treat the causes, because when you only treat the symptoms, they come back. And that's the problem. And what I can tell everyone before we go into that we should think about that we are on the lifeboat. We should be the lighthouse for our patients, that we give them the orientation. And it makes no fun to see your patients after 10, 15, 20 years back and you recognize that there's something wrong. And then you try to find out what's really going on. And so this is a new topic. And I know that the role of the traditional orthodontics is difficult because they learn so much. They learn everything about biomechanics. They know how to bring teeth from point A to point B. But in the end, this is not the crucial thing. It's more about knowing why the reason for the position of the tooth is there, and how to bring the treatment protocol to that, how to have a treatment protocol for expansion. What about dental expansion, dental alveolar, skeletal expansion? And this is the protocol what we should bring. and I expect that we can bring this. And so we give an overview for adults. We bring a protocol for growing patients. And according to the literature, it's not about our gut feeling. It's everything what's there. And we shouldn't talk about our specialty in everything. It's about having a protocol for each one in the end of those 2 days, and to realize that we are all on the same line. So that's my common goal for the Vienna Airway Congress, that we have a protocol for structure, for function and behavior, and we have a protocol for what to do and why. So yeah, that's everything.
That is incredible. I cannot wait to attend this conference. Dr. Florian, how can we redirect the trajectory of craniofacial skeletal deficiencies that begin in infancy at a young age?
I didn't hear it. Can you say it again, please?
How can we redirect the trajectory of craniofacial skeletal deficiencies that begin at an early age?
Yeah, I think we should start very early with the kids. And in our practice, I work together with Claudia Pinta. We see a lot of kids, and you can see the kids if you look at their palate, and if you look at when they speak, what do they do with their tongue? You can already recognize if they have deficiencies. And we try to start very early. And I send all my patients directly to Dr. Pinta.
Dr. Pinter, what can be done with the little ones to
Well,
change their facial growth?
I think, first of all, the most important thing is that we, doctor, see it, that we recognize manifestation of sleep-related breathing disorders. For example, manifestations in a small child could be that they're very tired or that they have difficulties with concentrating. And if we then look at the upper jaw, and it is very narrow, I always go and ask, how's the breathing? Can you breathe through your nose properly? I ask the mother, is the child sleeping with the mouth open? And usually the answer is yes. And then we also look at the tonsils and look at if they're enlarged. And I think there's, so it has always been there, like the tonsils have always been there, but before I knew of what the implications of enlarged tonsils can be, I did not look at that. So this is why I'm very excited to have different specialties, ENTs, or doctors who are trained in several disciplines, like Dr. Liu. And so we can work as a team. For example, Dr. Florian, if a patient comes to him asking for a full mouth rehabilitation because they see that their teeth are not in a good condition, but they don't know what's going on. They just see, my front teeth keep chipping because they're so thin and they keep chipping. What Dr. Florian 6 knows is that there are manifestations of sleep-related breathing disorders. For example, if a patient comes in and has incredibly eroded teeth, like some acid has washed out all of the enamel, and that patient is not bulimic, it doesn't have any eating disorder. So the question is, what is the reason? It could be a reflux that is produced by negative pressure caused by excessive snoring. So Dr. Florian 6 sees that. Then he sees the narrow upper arch. So he sends the patient to me. And before he does his full mouth rehab, we now can address the cause of the problem. Rather than treating the symptoms, we try to address the cause. So we do the maxillary expansion to make sure the patient can breathe through his nose during sleep, that there is not this negative pressure in the upper airway, and hopefully get the reflux under control through that. And then he's ready for the full mouth rehabilitation. So the dental work will last much longer because we're able to address the cause.
Dr. Florian, can you share with us why is it important to make sure that whenever you rehabilitate a patient, the teeth are put in the correct position? And how do you find that position? Because I love everything that you're doing.
So if you want to find the base line, we use a lot of tools. So we, for example, use Mojo to see if the function is correct. We use the COES deprogrammer to see where is the perfect position of the jaw. And we also try to see in the first line if the airway is correct. So for example, we look at the sleep, we use the WatchPad 1. So that there is a device you can use at home, and you see if there is any sleep apnea, for example, that we also try to treat with the expansion of the palates. And Christian and I, we already did some surgical expansions. Probably he can tell us something about, he did a lot of cases also by himself. And yeah, we try to set the patient in a correct starting point where we can do our prosthetic treatment afterwards.
My goodness. Dr. Claudia, really quickly over to you. Some orthodontists suggest waiting to begin treatment, particularly expansion, until after 6, sometimes 12 years old. Why is that way of thinking not optimal anymore?
So I think below the age of 8, we also need to take into consideration the cooperation of the child. So we don't want to traumatize them, but if they're open for treatment, then we can definitely address transverse deficient and too narrow upper jaw. However, we now know that if somebody is born with a underdeveloped maxilla, this problem will continue to persist. So even if we correct it at one age, it will pop up at a later point in time, because the jaws continue to grow. So even though the development of the maxilla, most of it is done by the age of 8, we continue to grow. This is, for example, patients who have a class 3, underbite that was corrected at the age of 12. They somehow relapse at the age of 30 because the jaws continue to grow a little bit. So we need to make the parents aware that, okay, we treat at several stages of their life. However, I would not wait until the age of 12 if there is a problem with breathing. I mean, we need to imagine the brain is developing so rapidly. If it doesn't have enough oxygen, that patient, that child might not grow to its full potential. So I think in orthodontics, certain guidelines were set, maybe not to treat too early because then the patient will need treatment again. So they tried to find a balance to make it cost efficient and also effective when outcomes. However, we need to assess the severity of the problem. So if there is a sleep-related breathing disorder, if the patient sleeps not good, then let's treat it. If we can do something about it, let's do it. And I guess that, like, if we ask the patient or the parents, it's their child. Do you want to correct it now? We maybe have to go in another time later. So that will be additional cost. If they know this has an improvement for the child's life and development, they're happy to go for it. And we can discuss it that openly.
Amazing. Dr. Christian, can you please explain a little bit about jaw growth and counterclockwise rotation?
The idea is always, when we started with the airway, is to think about what's the ideal adult patient for airway. So we have different structures how to define it. So when we see the sagittal position AP, we know that the related fact or the related literature to that is the PVA line. So that means where is the position of the maxilla, the A point. So what's going on with that? We know from that that this development, this growth ends at the age of 10, 11, maybe 12, but then it's over. What's going on with the growth of the transversal dimension? This means the position of the tongue. We know that we should have 24 millimeters at the age of 6, and we want to have at least 36 to 38 millimeters when the patient is grown up. So we should define a new protocol for that, how we go into, and that means we should start much more earlier than we know. When the dentition is over, then we know, okay, this patient is 12, 13, 14 years old, and it's much too late. So we have to go very, very early into that. And that's the reason why this early childhood intervention and assessment is so important for us as a dentist, because the pediatrists don't look at this because they don't have the reliance to that. And so where do patients regularly go? It's to the dentist, and then they send it to the orthodontist, and that's the biggest part. And then, Renata, you know this, how important it is to have the right structure and the right function, because this is now the entry to the development. And so we have different structural parts like the arch form, if it's a round palate, if it's a Gothic arch palate, how we can do the suction on the palate, how we can position the tongue, how important the role is for the force of the tongue, how important is the role of the swallowing patterns. And this creates everything. And this epigenetic role of the function is so important, because when I go back to this ideal adult patient, how we think about what is the ideal adult patient, structure, function, behavior. And when we go back to the youth patient, the grown up, the teens, then we go back to the child, to the infants, and then we see what's really important is it's the function. Everything starts with the function. And then this whole thing is coming up. And then we have this crucial role of this structure, what we then define for our treatment for structure, how we do the expansion, how we do the sagittal movement of the maxilla. But everything starts with the function. This is so important. And then I, as an orthodontist and a general dentist, try to bring this structure forward and to train my patients. And the third part is the behavior. So patients have to adapt, and often they can compensate. But do we really want that they compensate that much? I don't want that my patients compensate, and I want that they have a stable situation for the rest of their life. And everything from the symptomatic point of view is coming back when we said we don't treat the cause.
Oh my gosh, I can hang out with you guys all day. I wanted to ask Dr. Clemens something, but I'm not sure if his internet is good. Question was, do you believe the adenoids become enlarged to limit the body from releasing CO2 too quickly? Does anybody want to touch on that? I was telling you guys I was with Roger Price today, and they checked my CO2. So it's supposed to be from 38 to 42 is ideal, but at least 35. And mine was like 20, 25. It was so bad. And then during the time he did a hand-guided breathing, and then it got a little bit better. Then I actually lay down and I eliminated all the posture compensations, and it got a little bit better. Then he did a diaphragm release. I was so tight. And that made it so much better. And then Dr. Louis Chan came and did acupuncture, and then night and day. Went from breathing 20 breaths a minute to 4 or 6 at one point. Is incredible. So we always are talking about the CO2 pressure in the lungs and how important it is for us to teach our body to be able to hold on a little bit more to that CO2 by exhaling longer, doing shorter inhales. So somebody asked if maybe the adenoids becoming enlarged could be a way for your body to try to hold on a little bit more to that CO2. Not sure if that would impact.
Who asked that question?
I just got somebody send a message.
Oh, I can take a stab at it, but I'll wait. Do you want me to try?
Yeah.
I love that question because I've been troubled by that lately. And especially I've been troubled by that since the Olympics. Because if you then look at, long story short, if you look at all the winners of your 100-meter freestyle, all those swimmers would look a lot like your patients. And I mean, on the more severe spectrum of which. Since this year, the winner is a Chinese person, it turns out that the same craniofacial features were found in the Chinese person as well. So apparently, if you want to swim really fast, you want to have narrow upper jaw, very narrow, so narrow that the mandible turns out a little bit crooked because you have a functional shift early on in life. Chances are you retained your adenoids, although I don't know what the swim water does to the adenoids. That I don't know. But this concept was an old one that, Christian Guilleminault and a bunch of us have always been wondering, like, well, if you have these swimmers who are obligate mouth breathers and they're very good at swimming, right? Is there some evolutionary advantage to having a narrow jaw? Is there an evolutionary advantage of mouth breathing? Is there an evolutionary advantage of having huge adenoids? The answer is yes. I guess if you are going to be spending most of your hours in the swimming pool, I guess that would be the evolutionary advantage. So I'm not saying whether that's good or bad. I'm just saying if that's what you do. And so to look at my thoughts a little bit more, I went on to look at all the winners of your 10K, 15K distance running people. Now you go look at it, but what you're going to see is as they go to the finish line, first of all, before they get to the finish line, they're already smiling. They're nasally breathing. They're smiling till the very end. And I could see their incisors from you could see them from the second deck up in the stadium. Okay. And then the third one's mouth breathing, and that's why, he got the bronze medal. So I'm going to tell you, whoever posed that question, I want to meet you, whoever it is. It's a very interesting question. I think in the end, of course, I do believe that the carbon dioxide retention is a response, of course, to, right, let's say the consequences of the function of breathing itself. But yeah, like everything in life, there's no good or bad. I mean, Christian, if instead of this Vienna run, you wanted us to go on a Vienna swim, I might do better than that. I can't swim for a long time. That's this. Anyways, great question though. Love that question. Something that been pondering more and more as you see, since we briefly mentioned CG. Every time I talk to this group, this Vienna group, I always wonder what would he have said. You got to understand 2015 and, those early years, and with when he and I was talking to Audrey and myself about, just expanding adults at that time, right. On the more starting that discussion. I wonder what would he say today? I remember that first meeting that I was with him, that second AAMS myofunctional meeting when he was there, just soaking it all in and also sharing with us, he was pivoting right towards a lot more myofunctional, etiology and contribution to sleep breathing care. And then today we have like a conference like this, with experts like yourselves doing it. I just wonder what he would have said or how he would have felt. I would imagine how he would have felt is, see, I told you so. See, look, these dentists and then these myofunctional therapists, they have to be involved with this, from quickly. And then the second thing he would have said is probably, but the French was already doing this before these German-sounding people. That's my imagination of what he would have said.
Oh my goodness. Dr. Christian, I have two questions. You mentioned the sagittal growth ending at about 10, maybe 12 years old, the transverse growth about 24 millimeters at age 6. How about the vertical growth is my first question. What is the age of the patient? What do we expect as far as vertical growth? And my second question is, what can you do with the mandible? Is there any way to bring it forward?
So let us start with the vertical growth. When we see the maxilla as itself, we know that the maxilla is divided in 3 bones, both on the lateral and one in the front. And when I come back to this backward planning, what do we see often in patients who breathe through the mouth and don't have the tongue on the right position? We often see this VME, vertical maxillary excess.
Mhm.
What's going on with that? So the growth of the maxilla is forward and down. And when there's no force against that, the whole premaxilla is coming forward and down. What do we see in these patients in the nose? Because the frontal part, which is not connected on a bony part to the midface, what's going on with that nose? You have this small ankle here, and this whole nose is coming down. So what we want to have is, for an adult patient, a patient with a horizontal growth pattern. Do we really have the ability to see patients growing in a real horizontal growth pattern when they don't have the ability to grow horizontal? That's the question what we should ask ourselves. And
Ooh.
what's going on with the mandible when this whole thing is not able to rotate into that? Do
Mhm.
we have an epigenetic factor to the growth and to the vertical growth pattern when even the whole maxilla is growing forward and down? So these are the cool questions where we should see it literature. And then we have this intra-arch growth, which means the maxilla has those this dental bony part, this dental alveolar part, and the skeletal part. So what's going on with the dental part when we have this functional part into that? So what we often see is those step on the posterior teeth when the tongue is doing that, has this overflow on posteriors. So what we think is, okay, these posterior teeth have not grown right, but the real answer is they grew right, but they don't have the ability to grow right. So this is like an inhibition to grow in the right dimension. So what we even see on the palate is that when the tongue is not there, the whole dental alveolar part is coming down into the inside. So we have this negative arch, this negative torque on dental alveolar and dental parts. So we have this arch shape where no one on the world is able, even when we have this transversal dimension, to have the right suction with the tongue. So what we should think about now, and when we have these patients here, when we do all the expansion, when we do all these alignment of the arches, and patients have not the ability to adapt their tongue on the right side, we have even to think of the architecture of the palate. And what we see now is when we do some gum or some coloplasty on those palate, and they form it with the tongue, they can immediately swallow in the right way, and they can have those lingual palatal suction in the right situation, and they can train now from the myofunctional part, and that's the cool stuff. And the other thing is, when patients grow, and orthodontists always look at the mandible because they see that this is the real difficult part to develop, transversal dimension, growth. The answer to this, and when you see the literature, is when you go too late into that, the story is over. You have no chance to bring the mandible forward. The earlier you get in, the earlier you can bring some development to the growth. And then you see that often the inhibition is the minor growth of the upper jaw. And so that this whole mandible part has no chance to come forward and to grow in the right transversal dimension. So these are all the protocols, even what Stefan Decker is bringing to our course. That's the treatment. Clemens does the assessment and Stefan is doing the treatment of the kids. So this is now the cool things what we should learn here.
Dr. Clemens, what are some things that parents can look as red flags right now in their own children that are things that you can see in the office? What are you looking for when kids come in?
Yes. This is a really important question because this is the part where it all starts, right? The kids come to our office by their own. The parents are coming with their kids. So often it's very simple things parents can look for in the children. It's how they sleep. It's mouth breathing. It's how they swallow. Are they tired? Are they not focusing enough in school? So many points. If
Uh-oh.
they are
I know. I'd rather be in Italy too. Guys, it's almost 2 o'clock in the morning in Australia. We set this up. It's the only time that we could get everybody together.
some frostbite. This is
We're losing you, Dr. Clemens.
really red flag in young children if there's crossbites already. And
But Renata, maybe one more question for you. One last question. Like, if we were the ambassadors for myofunctional therapy, what would be the message that you want to get out to dentists and orthodontists?
Oh, that we have 3 pillars. Myofunctional therapy works so well, but it works well because I don't work alone. Airway first. This tube needs to be free and clear. We got to work with an ENT to make sure that that's happening. Pillar number 2, upper and lower jaw. They need to be big enough to house the tongue and the teeth. Number 3, the muscle tone, strength, and function. If those are not working properly, if you only address 1 or 2, the patient is going to relapse. So I need y'all's help. I can't work.
Write that.
I know. I actually have 2 quick questions. Can I do 2 quick questions? This is for Dr. Florian and Dr. Christian. You guys can go back and forth. I wanted to talk a little bit about asymmetries, asymmetrical expansion, because I have so many patients, adults, that send me messages saying, I'm so afraid to get any of this done and end up with asymmetric expansion. Number 1, how do we avoid that? And number 2, Dr. Florian, this one's for Dr. Florian. After we're already all messed up, do we have hope? Is there something that can be done to fix us? You guys,
of course, there's hope. You should all come to the Vienna Airway Congress to learn all this stuff.
This is the right answer to everything.
So asymmetric expansion, what do you do?
To asymmetric expansion, we know how to place the forces with the MAPI, with the RME, with everything. Then we have those forces against the force, and these are the resistance of the bone. And we should think about how to bring those resistance, or to how to measure it, how to define it. And this is everything. So when we see patients like in the dome therapy, the new protocol, how the expansion works with the facial weakening of the bone there. So we can do it unilateral, or we can define it doing a little bit less on one side. So when we have those expansion to that, it's easy to bring that in. And the most important step is to have a protocol and to do the documentation in this patient. So when you start the treatment, it's not only doing the initial documentation and the final documentation. You have to see what's really going on, and then you can define it, and you can compensate it with dental alveolar expansion. You can compensate it with dental movements. So this is the right way to do it, to know what movements are possible, to know the resistance of the forces, and then let's start.
Perfect. Thank you so much. Last words. We're just going to go really quickly around the room. Why should they come to Vienna Airway Congress? And those who are from Vienna, tell us a little bit of what else they can find in Vienna. So make this a trip out of it.
So
Dr.
I really have to go. My wife is already waiting. We have a big birthday party. And I'll tell you, I will run with you in the morning, and I will show you around the inner city of Vienna and give you some insights. So
amazing.
I'm looking
Thank
forward
you.
to see you all there.
And you are a great host. Thank you. Thank you. Dr.
Thank
Claudia,
you very much for the
Thank you,
invitation.
Florian.
Bye. Ciao.
Wow. Dr. Claudia, are you muted? Yeah.
Okay, I will continue with the next reason to come to Vienna. I'm sure your partner, your wife, your husband always wanted to see Vienna, so it's a great trip to do where you learn something and your partner has a good time and you can do this together, and it will just be the most wonderful time.
Yay. Dr. Clemens.
Yeah, I hope my signal will be strong for this one. So the most important thing for me is like building a group, building a network. We cannot do this on our own. We need to get in touch with people, other expert professionals, friends, become like a huge family together, working on this amazing new topic, see all the chances we got in our hands, and building this community. This is a really important point for me.
Perfect. Dr. Christian, last word.
You know what I'm telling to all the colleagues, we will be the Generation A, the Generation Airway. So this is a whole big thing, and we only can solve this whole thing when we work together. And we can be in this beautiful city, in this beautiful hotel, where we have those 2 days together and more, and to connect each other worldwide. So we have participants from all over the world. They are coming and want to share the knowledge. It's not only that we are talking, we want that you are talking, and that you share your knowledge, that you share all things your experience, and that's all about that.
Amazing. Claudia, can you go really quickly? Who are the other speakers that are coming? Anybody else you'd like to share about?
So we will have ENT doctors. We have myofunctional therapists with you. Yes, that's
Dr. Decker.
Stefan Decker, a pediatric orthodontist from the UK. Christian, help me.
I believe you have an allergist too, right?
Right, correct. Yeah, allergies.
And Dr. Paula from Italy.
Yeah, she's so we will have in the audience, there will be very advanced orthodontists, those who are progressive, forward thinking. So it will be a great opportunity to network and to get to know
and see Stanley run with his mouth closed. Guys, thank you so much for spending some time with us today and sharing with Airway Circle where you guys are creating. This is going to be beautiful. I know it's going to be the first of many. I wish y'all all the best luck and success with everything that you're doing with the Vienna Airway Congress, and I cannot wait to see y'all.
We're so honored to have you. Thank you, Renata. You're really adding a lot of value.
Thank you, Renata.
Like everybody else. Thank you.
Thank you, everybody. Have a wonderful day, night, wherever you are.
Bye.
Sleep well.
Bye-bye.
Bye. Thank you.